Good evening, everybody. Welcome to the PANSIGHT webinar. And I would like to
Morning,
start.
sir.
I request everybody to keep your mic muted. Muted means muted. And please don't unmute till the end of my presentation. During the presentation, please don't ask any questions. You can ask all the questions after the presentation. During the presentation, I will be seeking some information from you, and that one you can respond through the chat box. I'll be posing simple questions which requires an answer yes or no. If it is yes, you have to type in Y. No, N. If you agree, type in A. If you disagree, type in D. If it is a true, type in T. False, F. Nothing else. So, now let me start the slideshow. I assume I'm audible and the slide is visible. I'd like to get some information from you. So I'm going to pose some simple, straightforward questions. When you, as a patient, go to see a doctor for the first time, you are a new patient to that doctor. Usually in India, you may be going to a government hospital or a private hospital. So in the private hospital, a doctor, a general medicine physician like me, how much time does he or she spend with you? In the chat box, put the minutes, 5 minutes, 10 minutes, 15 minutes, or 6 minutes. Put that on. I need that information. Give me the number. Okay, Velappam Pillai is 5 minutes. Again, Prasadji, 5 minutes. Then another person, 8 minutes. Anybody else? Only 3 people know. Okay, Naveen, 10 minutes. Now the very same, this one, scenario, government hospital. How much time? Chat box. In the private hospital, you pay. The government hospital, you may not have to pay. How much time? Okay, 3 minutes, 2 minutes. Okay, 3 minutes, fine. So now, I'm sure that you'll all agree. Most of the time, the doctors don't spend more than 5 minutes. Most of the time. Do you agree? If you agree, put A in the alphabet, in the chat box. A, good. Srigamarji and Velappam agree. So 5 minutes. So that is where the relevance of this topic, today's topic. Purpose of this talk is to share 50 years of experience. I started practicing medicine in 1974. So 50 years of experience-based knowledge to enlighten and empower you for a healthy life. This cartoon appeared in the Wall Street Journal. A doctor throwing the patient out, and it says, "You are fired." So in America, Sometimes some patients, they fire their doctors. And sometimes the doctors also fire the patients. I was fired by some of my own patients. That one, in the later part of the presentation, I will tell you why they fired me. So that's a reality. In India, the doctor will say, no, 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 I don't want to see you again. You go and see some other doctor. You don't have to come to me. No. Is it something very uncommon, or have you experienced this sort of a situation? If you have experienced, or if you know such things happen in India also, the doctors firing the patient. If you are aware, if it is true, in the chat box put T. Then I will explain why that is happening. Because you need to know why these things are happening. Only Prasad ji, nobody else? Okay. Okay. I told you to enlighten and empower you for a healthy life. And somebody else has unmuted. Please the microphone of Jaykumar Menon. Yes. As a doctor, being a doctor, I know most of the doctors, they hate, I use the word, hate difficult patients. And when they hate, they would want to get rid of those patients from their care. So, have you ever, Prasad ji, every time somebody enters, that ding sound comes. Could you please turn off that sound? So, the doctors, if they hate the patient, the nurses also, if they hate a patient because that patient is difficult, the patient is not going to get the kind of care he expects. And have you ever had the opportunity to listen to anybody giving a talk on difficult patients? If it is no, in the chat box put N. If it is yes, put Y. Have you ever heard anybody giving a talk on this topic, difficult patients? No, no, no. Okay. I'm not surprised because I think, to the best of my knowledge, I'm the only doctor who has taken pains to give this talk. This talk is something like oxygen. This talk is very useful and will be very insightful also. This is my guarantee. This talk is based on FEQT, facts, experience, that is from my own experience. Quotes and thoughts. I did talk to nearly 7 doctors in India. Some senior doctors, junior doctors. And I asked them one question. Hey, could you please tell me about difficult patients? Who do you find difficult? So from their experience also, my own experience, as well as the experience of the fellow doctors, I'll be sharing. And thoughts, my own thoughts. Definition of difficult people. People with certain personality traits that make it difficult to deal with them. my own words, body language of the patients and doctors usually reveal their personality and attitude. Please read this one and please silently and remember these words. Right diagnosis depends on good history. Good history is absolutely indispensable to make a right diagnosis. If the diagnosis is wrong, then the management or the treatment will go wrong. It's so obvious. But that is what is happening. That is what is happening. You said that time, 3 minutes to 5 minutes. Especially in India, the population is very large. In USA, we usually get, for a brand new patient, 30 minutes to 1 hour. But in India, 5 to 10 minutes. Even after getting 30 minutes to 1 hour, here again, the doctors find it hard to make a right diagnosis because of the inability of the patients to give a good history. I won't blame them. They are not aware. They are ignorant. So that is why the purpose of this talk, to enlighten you. That is what is a good history. How should you give a good history? If you want the right kind of care, history is the most important part of the whole encounter. 80% of the diagnosis, I repeat, 80% of the diagnosis depends on the history. 20% only on investigations. And the investigations are done to confirm the diagnosis or exclude the diagnosis. But what is happening? They are not getting a good history. So what happens? The doctors order all unnecessary investigations. And I know some doctors order unnecessary investigations because they get a kickback, unethical practice. That's also a reality, but not everybody, every doctor. Because there is a time pressure and there are other patients waiting and you are not able to get a good history. Okay, they will order CT scan, MRI scan, ultrasound, this one, that one, everything. So, cost of medical care goes up. My dear friends, CT scan is not a safe investigation. The amount of radiation one gets from a CT scan is more than taking 100 X-ray. That much of radiation. So if you want to protect yourself from getting a wrong diagnosis and unnecessary pricey investigations, pay close attention to me now. In Hindi cinema dialogue, Khan Kolkar Suno. Okay? Khan Kolkar Suno. Sir William Osler, the father of modern medicine, he was a Canadian physician. He revolutionized the medical education and bedside manners, everything. He was a very astute physician. This is his advice. Listen to your patient. He is telling you the diagnosis. My dear friends, Heart attack. Heart attack is a condition where angina, you must have heard about the condition, angina. That diagnosis is 100% based on good history. Description of the pain. If the patient gives a good history of the pain, you don't need any investigations. And sometimes most of the investigations will be negative also. ECG may be negative, but a good history. That's what the William Osler is putting that emphasis. Listen to the patient. He is telling the diagnosis. When the patient, a good historian, the patient say chest pain. And this body language also, where he puts his hand, and whether he puts the hand like this or like a fist, having a heaviness. Yes. That tells the diagnosis. But the doctors are also now, I will put blame on doctors also. Lack of time. They rush through. So eventually, no. I was in India for 5.5 years from 2009 to 2015. When my father at the age of 85, he had a fall, then he was hospitalized, then he was sick. When I went there, I thought I had the opportunity to witness the competence of junior doctors. No way. So I decided, no way. I lost all my confidence and trust. So I decided, okay, I resigned my job here. And I thought, okay, I'll spend my time with my dad. And I took care of him. All minor elements for the next 5.5 years, he didn't go to any hospital. I didn't send him to any hospital. I know that is, if he goes to a hospital, they will do all sorts of unnecessary investigations. Poor historians. We usually, in our notes, we write sometimes, patient is a poor historian. What does it mean? Ramblers. They are not focused. They are not organized. When you ask something, they jump from here, there, everything, totally. What is your illness? Yeah, what, my illness? Yeah, and yeah, that is 3 days back, time, no homework. They talk about many things. Chest pain, then I'm see abdomen, I'm having this one. And yesterday I had this one. They jump from one symptom to another symptom. Rambling. Beating around the bushes. They don't come to the point. They talk about all the irrelevant things. For example, I'll give you a real life example. Especially in Kerala background. If a patient comes, suppose that patient is a woman, 60 years old. So, what's the problem? You know, my nephew, he's in Dubai. And he went to Dubai 10 years back. Time. Talking about 10 years back, why now you have come to me. Instead of talking about your symptom, you talk about that guy. Then again, if the doctor says, I'm coming to that one. And 1 month back, he came on vacation. And he came to my house in the afternoon. And then I asked him, do you want coffee or tea? And he said, coffee. Then I went to the kitchen to make the coffee. And that time, my cell phone, it was in the bedroom. It rang. So I immediately rushed to take that one, and I slipped and fell down. How much time is wasted? What's the relevance of that nephew and all those things? The history should have been last month, I slipped and I fell. You get my point? Am I making myself clear? If I am clear, put C, alphabet. Because I want to make sure that is whatever I'm sharing is something easy to understand. Is it clear? Yes. Prasadji, clear. Only one person? What about others? What about you have some kind of weakness of your fingers? Okay. Well, let's see. Yes. So, all this beating around the bush. Now the doctor loses patience. Then what will you do? Back pain. Right. Okay. I will give this medicine or take this medicine. And either he gives a prescription and the time is up. Even he may not even have the time to examine the patient. Or he may make a cursory exam or MRI scan. Send for an MRI scan. And then the patient is blamed. He didn't even touch me. He didn't even examine me. Come on, you wasted your time. You had the opportunity to tell what your problem is. You are talking about your nephew, Dubai, coffee. That's what is happening. Real life scenarios. There is beating around the bushes. Piecemealers. They won't give a good history. Bits and pieces. Just okay. Okay, Ajay okay. So, okay, what's the problem? Problem. I'm having fever. Then the doctor has to ask for the question. How many days? A few days. Few days means what? 3 days or 5 days? Yeah, 3 days. Okay. Anything else other than the fever? Headache. Then where's the headache? You understand my point? The doctor has to ask many probing questions to extract the information. We don't have the patience. We don't have the time. Piecemealers. Some of you may be like this. After watching listening to my talk, you have to change. Be a good historian. Before going to see a doctor, you must rehearse very well. You know it will be only 2 minutes. Within that 2 minutes, make sure that you present all the symptoms. Suppose you are having headache and nausea. Fever, headache, nausea. Nausea means you feel like vomiting. Because of that, now you are not able to eat food well. And if you go and tell the doctor, after asking many questions, yeah, veshapilla. No, I don't have an appetite. Again, that's wrong. I feel like vomiting. But they say veshapilla. And feeling like vomiting could be part of that inflammation, irritation of the stomach by the infection. Suppose that person is having a viral fever. That will explain the fever, headache, that nausea from irritation of the stomach, that's called gastritis. If the patient doesn't give a good history and says nausea, the doctor may prescribe a pain medication, and most of the pain medication, I said most of the pain medications can, as a side effect, make the stomach pain worse. And after going home, after taking the medication, they may develop vomiting. So there was no vomiting before the patient saw the doctor. Now after taking the medication, new symptom. Who is responsible? Patient. If the patient gave the history correctly, I'm having nausea, then the doctor would have chosen a pain pill which won't upset the stomach. These are all real life scenarios. No other doctor takes so much time and energy to organize everything and present a talk like this. Flashbackers, oh, they live in the past frequently, just like the movie. What's your problem? Now 2024 becomes, what is the problem? See, in 2012 also, after the Onam, I had the same symptoms. And then in 2018, after the marriage of my daughter, you're going back to the flashback. What's the relevance? Come on, tell me what is bothering you. Such people, because of their long-standing, that old habit, they again and again go to the flashback. We doctors, we don't have the time, and most of us don't have the patience. So that is another type of difficult patient. Flashbackers. Replayers. They keep on repeating the same thing. What they have said again and again and then again. 2 days I'm having the headache. Actually, the headache started on Thursday. And Thursday. Yeah, 2 days back. How many times are you going to replay the same thing? Some of these repeaters or replayers. Then malingerers, they lie. They won't tell the truth. They won't tell the truth. They have some other hidden agenda. They may want subsequently a medical certificate for some other reason, purpose. They come to you. They don't have a real illness. They cook up some story. Those are also difficult patients. Types of patients. This is my own. You won't find it in any test book. This is my own, that thoughts I told you, original thinking. A, B, C, D, E. A, attitude of the patient. B, behavior. C, style of communication. 4, that is D, discipline. Lack of self-discipline. For the appointment also, they don't come on time. And they don't follow the instructions carefully. If you ask them to take that tablet 30 minutes before taking the breakfast on empty stomach, they don't. So lack of discipline again, they won't get better. Then expectation. Unrealistic expectation. They want everything to be fixed immediately. Get well soon. No patience. My dear friends, it won't happen that way. So they're frustrated. And then they go to a different doctor. This keeps on going. So A, B, C, D, E. Then 7 characteristics of difficult patients. Aggressiveness, rudeness, lack of manners. These days, especially in Kerala, dealing with patients is extremely difficult. Some patients so aggressive, arrogant, they beat the doctors, beat the nurses, and I know that is happening in other parts of India also. Is it true? If it is true, put T in the chat box. Is it happening or not? True. Prasadji. True. Because of that, this is happening to only modern medicine doctors. I haven't seen anybody going and beating an Ayurveda doctor or homeopathy doctor. Only modern medicine. And here again, the bystanders, oh my goodness, they are a real pita. Do you know what pita means? In USA, we use the expression pita. Pita is a bread, but this pita is not bread. Pita is an acronym for pain in the ass. Pain in the ass. That is what the pita. Some patients are pita, and bystanders definitely are pita. Aggressiveness. We don't like, nurses don't like. Passiveness, apathy. Some patients, they don't cooperate also. If you ask the history, they won't say anything. They sit there as if, then they make us feel as if we are veterinary doctors. Because the animals won't give you a history. Okay? They sit there. And the total indifference and apathy. Arrogance, egoistic VIP. They want to be treated as special. They want to jump the line. They quarrel if there's some delay. Impatience, poor listeners. They keep on talking. That is open mouth and closed mind. And one of my senior colleagues, long time back, I'm talking about this, I had the opportunity to work with him in a private hospital for a few months. He used a technique, creative thinking. If a patient keeps on talking, at that time the thermometer, you know that mercury thermometer, he has got 3 thermometers. You will take them. Open your mouth and put the thermometer inside the mouth and hold it so that he won't talk. Okay, you won't let him. You won't take the thermometer for the next 3 or 4 minutes till he finishes everything. Otherwise, this guy will keep on chattering. And paranoia, distrust or mistrust. Do you know the difference between distrust and mistrust? If you don't know, put N. I will explain. In the chat box, put N if you don't know difference between mistrust and distrust. No, Raji, no. Okay, only one person? Okay, Naveenji, okay. Okay. Subtle difference. Mistrust, yeah, some kind of a doubt or skepticism whether this doctor is really competent and whether this doctor is really smart or suspicion. No evidence. That is mistrust. Distrust, you have some evidence because a couple of your friends told you, oh, they took treatment from this doctor and they didn't get better. Or is because of his treatment, the condition got worse. So when they come to know about that one, now there's distrust. Is this clear? Mistrust, there's no evidence. And distrust, there is some evidence. Selfishness, oh, I must, everything. Demand, constantly call the nurse, nurse, nurse. Is an impatient. Most of these people are pita. The nurses hate them. Nurses hate them, they won't give. After one day, they won't give good care. If you antagonize, if a patient antagonizes nurse and doctor, forget about it. You are not going to get better soon. Then bitching, always complaining, grumbling. If you come with a pain, On day one, suppose on Monday, the doctor gives some medications. And the next day, when the doctor comes for the rounds, how is the pain? I'm still having the pain. That is not the way you should answer. If there's improvement, then you say there is some improvement. The pain is slightly less. Not I'm still having the pain. The doctor will feel good when you say if there's some improvement, or 20% or 40% pain is less. Learn to say that. Not, I have still the pain. Then the doctor will unnecessarily increase the strength of the medication. That will have more side effects, my dear friend. If it is getting better, the doctor won't change, doctor will wait. If you say no improvement, more dose, high dose. And because of the mistrust or distrust, they seek, difficult patients seek multiple opinions from multiple doctors. Nowadays, some people who attend my webinars, I don't know them, but they send WhatsApp message about their lab results, about their MRI scan results, and ask me to give my opinion. Okay? So multiple opinions. That is what, then this is what is happening. Then I should tell them, okay, why are you asking my opinion? I say, okay, either you trust that doctor or you don't trust. If you don't trust that doctor, go and see some other doctor who you will be able to trust. That's it. Don't ask opinion from me. I don't encourage. Oh, now we know. Dr. Google, and especially those who are computer savvy, especially the IT guys. My friend in Trivandrum, he tells me, oh my goodness, Venu, I find it extremely difficult to deal with these IT guys. They always come with a self-diagnosis. They have gone through the Google. They have made a diagnosis. Some of these guys, they go to the laboratory and order all the lab tests also. Then they come with the lab results and everything. And in the lab results, when they find that something abnormal, then they get worried. And that lab result, that lab test was unnecessary. Unnecessary lab test ordered. And the lab test was abnormal. Even if this one number is high, it will say abnormal. Suppose the normal range is, say, 5 to 40. If it is 41, abnormal. And this guy gets worried. So Dr. Google, doing a lot of harm. And read healthcare news often, especially in Kerala with a high literacy rate. High literacy rate. Almost every newspaper, leading newspaper, they have a magazine, health. Arogya Kaumudi, Arogya Rama, Arogya Bhumi, like that, easily some 10 or 12 healthcare magazines. They buy everything. Read. Then what happens? The first 3 pages about the headache, a neurologist, he writes something. After that, Ayurveda, Vada, Pitta, Kapha, another 3 pages. Then the Siddha guy, he's on this one. Then comes the Unani. Then comes the naturopathy. Then homeopathy. And my teacher, Dr. Matthew Roy, he is no more. He used to say, they consult all different padis. Homeopathy, allopathy, naturopathy. They should consult only Venkatajalapathy. And he used to say, only Venkatajalapathy. Not all these different padis. And they get thoroughly confused. Each system is different. And they watch all the TV, healthcare related TV programs and TV channels or YouTube. Then they seek opinions from alternative medicine practitioners. From allopathy physician, they consult. Then within a couple of days, they go to either an Ayurveda doctor or a homeopathy man or Unani. It's common. It is very common, especially only in Kerala. Kerala is one state where multiple systems of medicine are prevalent. Then 5 types of difficult encounters. Unrealistic expectations. Unrealistic expectations. Expecting everything, a quick fix, everything. Their lifestyle, they won't be willing to change the lifestyle. Most of the health problems are cultivated or invented or developed because of awful lifestyle. They want everything to get better within 1 day or 1 week. That is unrealistic expectation. Then drug and investigation seekers. They have made a self-diagnosis. Headache, my dear friend, 90% of the headache is not because of brain tumor, or more than 90%, not 90%, 98%. Is not because of brain tumor. Of that, 80% of them are because of psychosomatic. You know, psycho means mind is the cause. Mind is the cause, effect is on the body. So the mind again, you need time to get a good history. If a person says that, I don't have a sleep, I'm not able to get good sleep, that's a symptom. The doctor is not, he doesn't give a good history, doctor doesn't have the time to this one, he will immediately prescribe a sleeping pill. He is not getting sleep because of some underlying anxiety or fear or stress. Unless that one is taken care of, root cause is not going to disappear. So that is the point. Psychosomatic. Headache again, psychosomatic. But when they don't give a good history, that's one thing. And these people, they read the magazine. Sometimes it may be due to brain tumor. Okay, now they get worried. Oh, I may be having brain tumor. I witnessed this one. In 2012, when I was in India, I went to a hospital. There, my friend, a neurologist, he was working there. He was one of the few neurologists, very ethical practice. He wouldn't order any investigation unnecessarily. And when I went to see him, he was with a patient. Then I said, okay, I will come later. He said, no, come in. Because in USA, privacy, you cannot. When somebody else cannot get inside. In India, it is okay. So I went and sat there. And he was taking the history. And I listened to the history also. And he is very good at taking history. He is very good. He will ask pointed questions. And after the history, some another 5 minutes of whole interaction, and he wrote a medicine. He told husband and wife. The patient was around 35 years old. Husband was around 40 years old. He said, okay, take this medicine. And after 2 weeks, if you don't get better, then you come and see me. Otherwise, you don't have to come. Now the husband talks. Doctor, what about the CT scan? Investigation, CT scan. My friend said, CT scan, Vanda, how she there? Yeah. She is worried. She is worried whether it could be brain tumor. So for her peace of mind, okay, my friend immediately wrote, okay, CT scan, gave to him. And when he left, I asked my friend, hey, why did you write CT scan? That is a tension headache. Well, no, I'm tired. These days, I'm not seeing patients. They are all doctors without a formal qualification. They make a self-diagnosis. Then they want to confirm or exclude. If I don't write the CT scan, they will fire me, they will go to another neurologist. I will lose a patient. I will lose my money, income. So, okay, you want CT scan? Okay, here it is. That's happening. Non-compliant behavior. Yeah. They don't watch the diet. They don't go for exercise. The diabetes is managed with the diet and exercise. They don't. And every time repeat the lab results, the blood sugar, everything keeps on going up and up. Manipulative behavior or verbal or physical abuse, I told you. They may, here in USA, the patients who fired me, I told you, I had to face a lot of verbal abuse, no physical abuse. Drug seekers, here, some patients, they want narcotics, that is opium-like drugs for their pain. Their pain, knee pain, there's no indication for narcotics, but they demand. When I explain, no, you don't need, and you need to take this pain medication. No, it won't work. It won't work. I have tried in the past. I want that Vicodin. That is the only thing that will work. So now I am having a difficult patient, a drug seeker. Then I know that if I don't write give him the Vicodin, he will go and complain to the patient advocate. And when he complains, he won't say, yeah, I asked for Vicodin, he didn't give me. No. He will say, Dr. Reddiar is very rude. He is very mean. And he called me names. Then I will find it difficult to defend myself if it is unwitnessed. So I had a very good rapport with my nurses. So when I find a difficult patient, I'll pick up the phone, call, hey, Paula. The moment if I call, she knows that there's a difficult patient. So she will immediately come. She's just across the corridor. When she comes, and this guy, why is she here? Because he doesn't want anybody there. I say, because I use my communication skills. That is English is not my mother tongue. So sometimes when I try to explain, you may find it difficult to understand. So I need her help to make you understand what I am talking about. So then this guy again repeats. I said, I'm sorry. I cannot give that medicine. What? I served my country. Where are you from? Pakistan? India? You are an asshole. And I will sit there with a neutral expression. Then I repeat, just like a broken record. I'm sorry. I can't. And he will shout at me, and he will call again many names, and he will just slam the door and leave. Then he goes and reports to the patient advocate. In my note, electronic medical record, I document that one clearly. Patient was demanding Nicodine. That's not indicated. So I told him I cannot prescribe. The patient was upset, angry, and he called me, asshole, everything. And this piece of conversation was witnessed by the team nurse, Paula. And then I make Paula also co-sign my note. Subsequently, when he complains to the patient advocate, and he said that I don't want that doctor. So that is how I get fired. I get fired by patients because I don't prescribe narcotics. And when the patient advocate sends me that complaint, I say, okay, please read my note. It explains everything. Why? The patient doesn't want me. That's it, over. Oh, verbally abusive patients. Many, many, many. Okay, now the talk is over. We have 10 minutes left. And you can ask any questions, clarifying questions based on what I shared with you. Nothing outside the points I shared with you. And just I would like to show one more slide. Then we'll start the Q&A session. Every week, Thursday, I give a webinar on my platform. This Thursday, Distress and Eustress Part 2. Part 1, I gave it 3 days back. Distress is bad stress. Eustress is good stress. Then sense and nonsense. If you want to take a screenshot, take the screenshot. That is the Zoom ID number and the passcode. Zoom ID number and passcode every Thursday at 8 p.m. I'm going to stop the slideshow. Did you find this session useful and insightful? If you found it useful and insightful, agree. Okay, Prasadji. Agree, yay. Okay, yay, thank you. And my dear friends, please watch the video recording and share it with as many people as possible. I am trying my best to help you all. How to be a good historian. And again, another thing also, when you go to see a doctor, please take, because you may be seeing different doctors and you may be taking many medications, take those medications with you. Otherwise, this is what will happen. A doctor has, here also in USA also the same thing. I'm taking a white tablet, another one yellow tablet, and a red tablet. My goodness. There's no way doctor will be able to know what is that white tablet. Then what happens? The doctor may prescribe a medication that may be the same medication with a different brand name. Being a layman, you won't know whether the ingredient is same. And when you get the same medication, then it will become overdose. I'll give you a typical example also. There is a medication called Compost. And the very same medication, diazepam, another brand name is Valium. And usually it is given in the past, given for the anxiety and the insomnia. And when he gets that one, and when he goes to a different doctor, and he says the same problem, and he also gives a different brand name, and he takes both, and he becomes so tired and sleepy next day, he won't wake up in the morning. He will wake up sometime in the afternoon. That is because of this one. So take all the medications. Don't go and say white tablet, yellow tablet, red tablet. These are all practical tips to help you to, you must take care of everything so that you'll be able to enjoy good health. Stop these WhatsApp university messages, real pain. And I do get some people, they forward that one and ask me about your comments, doctor. Your comments. And I say, sorry, I don't have any comments about these WhatsApp messages. And first and foremost thing, stop reading the WhatsApp messages. Who is the sender? Do you know who is the sender? No. Then what? It has become viral, spiral, and everything. Misinformation, disinformation, create panic, phobia. And Prasadji, he knows that one. This morning, yesterday night, I talked about the COVID, that time. What happened? Misinformation, disinformation through different kinds of media, rampant. People suffered from phobia. WhatsApp, if you use it in the right way, that's good. Otherwise, no. Stop reading healthcare magazines. Stop consulting Dr. Google. You consult a doctor, and before choosing a doctor, make sure, ask some 3 or 4 people. Word of mouth propaganda. Then when you go, do the homework, rehearse very well. Rehearse very well. In a short period of time. Present and give a crystal clear history. Take the medications with you. So watch this video again, because you are not going to remember everything. Because I have shared a lot of points. You watch this video maybe 2 or 3 times. That will do good for you. Okay, now, questions. Ramadevi Ambadi, she's a doctor. Do you have any questions? Okay, Naveenji. Okay.
Thank you for covering about
Come to the
the
point. Come to the
doctors.
point. Time. No thanks.
Yeah, yeah. Sorry. What about the patients being the other way? I think doctors have very less time for interviewing the patients there. Whatever the other thing, the diagnosis has been done and the treatment has been done. But after some time, 3 to 4 months later, it was been found by the patient that it has been diagnosed not correctly, and he goes and it was say, okay, I'm not the correct doctor, you go to other doctor. So what is the position by the patients has to be taken to treat the doctor as?
No, here the main point I was discussing is that many doctors, I'm not saying that all doctors, many doctors, they are not able to make a good diagnosis because of poor history. And if you give a poor history, when they make a wrong diagnosis, then if you don't get better, then you go and complain to the doctor again. Then the doctor may feel, oh, that is, you are blaming him. And then he may say, okay, if you are not there, you can go. The doctor will fire the patient. That is it. Nothing can be done.
I got it. Yeah.
But that is the way.
Okay.
The thing is,
Yeah,
I like to one more thing I just wanted to. I think the treatment of a patient, where we are going to go, if the patient touches you and talks you, there you see that he is the best doctor. I have experienced myself. Thank you. Yeah.
Okay, Naveen ji.
Hello, Dr. Venu.
Yeah.
Good morning.
Yeah.
For you, it is good evening, no?
No,
Okay.
Ramadevi, before that one, I didn't get into the bedside manners for lack of time.
Okay.
The bedside manners comes touch. That is connecting with a patient. I'm a high toucher. When the patient is I take a history, if it is a male patient, I usually put my hand over the shoulder of the patient and I give 100% undivided eye contact attention. By doing that one, the patient, I am able to get the trust of the patient. And that one is, these days, bedside manners, very few doctors are good at displaying the bedside manners. In the medical curriculum also, it is not there. And we don't have many good role models also. Okay, Dr. Ramadevi.
Thank you.
What you said is, Dr. Venu?
No, just a minute.
Dr. Venu.
Dr. Ambadi. Yeah.
Dr. Venu, what you said is 101% is correct. Even I used to keep that bedside manners. See, when I am telling to the patients, usually I am treating infertility. If if they are having a positive result, then I will tell you go and consult with the gynecologist. Then no need of coming here. Then they will ask, shall we come occasionally, doctor? They will ask because they got so much comfort from us. What you said was 101% correct. So many difficult patients, but we know from the first we will not get any strong information. By second or third sitting, we will get. They will. We can. At least I can make a good rapport with the patient. It was so crystal clear what you said.
And Ramadevi ji, infertility is not an acute problem. When acute problem in the emergency room, casualty, that is where. Now, if you don't give a good history, then the outcome will be totally different. Infertility, okay, next visit you can get a better history, or third visit, that happened. But that's not what I'm talking about. That's a problem here.
Yeah.
And
So I am the
infertility also,
I have to,
infertility also, if there is a conflict between the husband and wife, then
yeah,
if they
sure,
don't have
sure.
any kind of a sex,
We have to give counseling. Yeah, counseling.
right?
Yeah.
And
See,
the mother-in-law and parents, the parents-in-law, they worry.
yeah, sure.
Wrong with their
We have to
problem.
go through.
Yeah, it is not because
Mm.
of anything else. It is because they are not having any sex.
Yeah. They are scared. See, I got one medical camp. I have to attend that. Okay, see you. Okay, all the best. It was very nice, very impressive, very nice. Okay, thank you.
Okay, if there are no further questions, shall we wind up?
Venu, can you hear me?
Sure.
Yes.
Yeah.
Thank you, sir.
Shaji.
Thank
Okay.
you, sir, for
We have Dr.
your
Shaji Prabhakaran.
sharing your information. Okay.
Venu, is there a cultural difference in the dealing of an American patient and an Indian patient?
Shaji, here my main emphasis is on I am addressing a group of laymen who are from India. So by sharing more about the Americans, that's not going to make them wiser. But definitely, American patients and Indian patients, cultural difference is definitely. Main thing what I like about in America is the patients, most of them, they don't have any bystanders. They come by themselves. You are able to get a history from the patient. In India, they'll be accompanied by 2 or 3 people. And they won't let the patient give a history. This person will say something, the other person will say something, and it's a pakka nuisance. And we had one professor, Dr. B.K. Harindran Nair. Shaji, you may be knowing Dr. B.K. Harindran Nair.
Yes.
When the parents bring a teenage boy or teenage girl with some skin problem, and when doctor asks him what is the symptom, when the mother talks or starts talking or father talking, he'll say, history. I want the history from that boy. He can talk, right? He's not dumb. I want to listen to him. So the parents, they get upset. They never liked him. The doctor wanted to get a good history, and the parents, he asked the parents indirectly, you're saying, shut up. You're saying, shut up indirectly. They were not happy. So in our place, the cultural difference, that is a very good question. And that question relevance is too many bystanders. And again, every time when you go, there'll be a different bystander, and each bystander will want to know everything about the condition, what is going on. The doctors and nurses, they get tired of that one. Do you agree, Shaji?
Yes.
Right. Too many.
Sir,
Okay.
Sir, shall I add? Sir,
Shall
I add, sir? Yes. Sir, some doctors don't allow bystanders to talk. But I have an opinion that patients may forget to explain about their symptoms. So bystander can add. That way I am.
You use the right word now. You use the right word. They can add. That is the first, let the patient present everything. Then the bystander can say, doctor, the patient forgot to say this. Like that one, if you say, doctors will be happy. The patient forgot, I would like to bring to your attention. This is not what is happening. They won't let the patient even speak. They keep on talking.
Yes. That is not right.
That's the problem.
In Alleppey, there is a doctor. In Alleppey, there is a doctor, Chennai doctor. You may be knowing.
I know him.
Medical college. He is a general physician.
I know him.
He's a very good doctor. But he won't allow the bystander to talk. once I met him with my wife, and she forgot to say something. Then I talked to him. Then he told me, let her talk. Then I told him that she forgot. That's why I'm adding. Then only you can understand the position. Then he didn't say anything. Yeah, thank you, sir, for your information.
Yeah, if you want to add, wait till the end of your the presentation. Then you say, sorry, doctor, do you mind if I add something which the patient forgot to tell you? Then the doctors will welcome that one. Right from the beginning itself,
yes,
they won't let the wife talk, or the wife won't let the husband talk, or the parents won't let the children talk. So that is a problem. Okay, Sridhar Krupji.
Yes, sir.
Yes, sir. Your session was very fantastic and very excellent. But I agree. But I have one question. Sometimes it is my experience that I also not having that much, only 1 or 2 years, 1 year experience less than that of you only. But that with my experience, I observed sometimes the patient may don't tell exactly the correct symptoms. Then why I am telling, once that the patient came and she was telling and I took all the case and her bystander was coming, and after bystander was the second patient, and then she came and all the other ladies said was all it is wrong, exactly opposite. In such cases, what we can do?
In such cases, right from the beginning, that is, you have to ask some probing questions, just like the investigation. Sherlock Holmes was written by a medical doctor, Sir Arthur Conan Doyle. That is to find out the truth, whether it is a fact. The doctor should be smart enough to ask the right questions, so that you will soon know whether that patient is telling the truth, or that is the information or misinformation. So that skill a doctor has to develop. That's it. I'm good at it. I am really good at that one. I have read almost all the Sherlock Holmes books a long time back, and I'm very good at critical thinking. Today, Prasadji, he heard me when I participated in that meeting. My critical thinking skills I developed over a period of time. And next month, last month I gave a talk on critical thinking for the American College at Madurai. This month, 2 weeks back, I gave a talk on creative thinking. And next month, I'm going to give my talk on logical thinking. Okay? So thinking itself, different kinds of thinking. I'm really good at it. So my self-confidence, my self-esteem is pretty good. That is because I know how to think. Okay, now I think that it is time. Let us wind up. And I will, Prasadji, I will upload this video to YouTube and send you that link, which you can share it with others. Okay?
Thank you very much for in behalf of our forum. Thank you very much.
Thank you. Right.
Thank you, Doctor. Have a great evening.
Okay.
Thank you.
Okay, bye.
And the next week, are we going to have the difficult doctors presentation, or we'll have some more time?
Right. Okay. Thank you.
Can I have a photograph? Yeah. A photograph.
Photograph of what?
Of us attending the meeting.
You can take the screenshot. Take the screenshot. Okay. Right.
Thank you.
Good night.
Thank you, everyone. Good night.